So you've been diagnosed with fibromyalgia. So what is it? Well, it is an increasingly commonly diagnosed condition by primary care practitioners in the UK, by rheumatologists in specialist care, by pain physicians, and these days by a lot of other healthcare professionals as well. Now, there's no doubt that a condition like this does exist and that you are not making up the pain that's there in many parts of your body. What we now understand about fibromyalgia is that it is a neuroimmune condition. So the label and the term fibromyalgia actually is a bad label. It seems to indicate that it's something to do with the muscles or the fibers. And that is just the name of the term that came from the 60s or 70s, when indeed doctors used to think that if a part of your body hurt, it must be coming from that particular muscle or that particular fibrous structure that was there where the pain was. So it was a very structural definition of the problem, that it must be coming from the area where the pain was. We now understand, with the evidence that's come through after different kinds of research scanning and the understanding of the nervous system and the role of the immune system, that this is a particular kind of condition where the nervous and immune system are not functioning optimally. So think of it on a scale wherein on one side you've got a perfectly normal, optimally functioning nervous and immune system in tandem and connection with each other. Think of the other side where you've got the immune system that's so completely not right that you could possibly diagnose an autoimmune condition, or your nervous system is not functioning efficiently at all, and that might be the neurological disorders that a neurologist would diagnose or be able to be seen on an MRI. But between these two extremes lies a particular set of conditions where the nervous and immune system are clearly not normal but not completely abnormal. And it's this intermediate group where the nervous and immune system is oversensitive without being completely affected, but it is oversensitive, it's firing much more rapidly, it's influencing the immune system, it's activating the nervous system, and this condition where the nervous and immune system are amplified is what's called fibromyalgia. Now, the 2016 American College of Rheumatology has introduced certain criteria, and effectively those are the 4 principal symptoms that we see in fibromyalgia patients. 1, that there is chronic widespread pain, that is pain occurring in 4 to 5 of the regions of your body. So that can be your arms, your legs, your spine, your stomach. All of these are considered as regions which can be painful, so chronic widespread pain. Second is there is sleep disturbances. The third is there is cognitive problems, so what's called as brain fog or memory disturbances. And the fourth, which is actually the most common, is fatigue. Fatigue not simply of the tired kind, but it is sometimes debilitating fatigue that can be much more impactful than just the pain. So it's this combination of 4 symptoms that constitute and are seen in most fibromyalgia patients. And the reality is, this kind of condition can take time to evolve, and that's another reason why diagnosis is so unpredictable. Sometimes it starts with one region of the body that's painful, or fatigue is the first presentation, but over a period of 6 to 12, maybe going up to 24 months, all the other symptoms can start to happen, and that combination can take even up to 2 to 3 years to be finally present and for a diagnosis to be made. Now remember, for all of these symptoms, there should be no blood test that actually shows signs of inflammation or infection, and ideally most of the other tests also should come out normal. So these are the criteria and the ways of making a diagnosis of fibromyalgia, but specifically making sure that you do have a condition like that. So, just to reassure you, the condition does definitely exist. It is an increasingly common condition, but most importantly, understanding how it happens gives you the opportunity for doing something more tangible about it. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.